There's one thing I never let run out at home. Not food, not water, a little bottle of supplements. The moment it's empty, I start feeling anxious, irritable, I sleep badly. This isn't an addiction, this is simply magnesium. And by the time you finish watching this video, you'll understand exactly why I say that. Because right now, as you're watching this, 80% of people don't have enough of this mineral in their body. 8 out of every 10 people around you, maybe you yourself. And most of them have no idea. They blame the symptoms on tiredness, stress, age, but the real reason comes down to one molecule. Just 50 to 60 years ago, people got enough magnesium simply from food and water. The soil was rich in minerals, so was the water. Today, the picture has completely changed. Modern food is demineralized, refined, pasteurized, ultra-processed. By the time it reaches your plate, almost no magnesium is left. Add to that the fact that most of us barely eat fresh greens, leafy vegetables, or nuts, the main sources of magnesium. And the result is that we're living in a state of chronic deficiency without even realizing it. Here's a fact most people don't know. Magnesium is a cofactor for more than 400 enzymes in the human body. 400! That means without magnesium, a huge number of biochemical reactions simply don't happen. Reactions that are occurring inside you every single second. 60% of your body's magnesium is stored in the bones and muscles. Another 20% is in the soft tissues and fluids, and all of it works in tandem with ATP, the molecule that powers every single cell in your body. Your heart, brain, liver, muscles, every energy-dependent system in the body is magnesium-dependent. Not just benefits for magnesium, they literally cannot function properly without it. Here's something everyone with hypertension, tachycardia, arrhythmia, or a history of heart attack or stroke needs to know. Magnesium is the #1 mineral for the cardiovascular system. It regulates heart rhythm and vascular tone. It helps the heart muscle contract and relax correctly. That sounds simple, but the physiology behind it is enormous. Magnesium is a natural calcium channel blocker. That's the name of an entire class of prescription blood pressure medications, calcium channel blockers. Magnesium does the same thing, but naturally. It also acts as a natural beta blocker, another class of drugs doctors prescribe for arrhythmia and high heart rate. I see patients who are 30 years old with tachycardia and arrhythmia, not 70, not 60, 30 years old. And in 90% of cases, arrhythmia is accompanied by a deficiency of magnesium and potassium. And when magnesium runs low, the body starts losing potassium too. The two are deeply connected. This is exactly why cardiologists and emergency doctors, when facing acute arrhythmia, reach for magnesium sulfate, administered intravenously. That's not a coincidence. It's because magnesium normalizes the excitability of cardiac muscle cells and has a cardioprotective effect. The proven dose for lowering blood pressure is 400 to 600 milligrams of magnesium per day. If you're already taking antihypertensive medication, magnesium amplifies their effect. In some people, it makes it possible to reduce the dose of those drugs altogether. One important note: magnesium sulfate is only for intravenous use. In tablet form, it doesn't absorb and causes severe diarrhea. I'll cover the right forms to take a bit later in this video. Not many people know this, but magnesium is a natural blood thinner. In terms of its effect on platelet aggregation, it's comparable to aspirin. It prevents clot formation and acts as a natural anticoagulant. This is critically important for anyone with a tendency toward excessive clotting, thrombophilia, or abnormalities in their coagulation panel. Magnesium helps prevent stroke naturally with none of the side effects of pharmaceutical blood thinners. Now, cholesterol. Here's something almost nobody talks about. Magnesium is a natural statin. It affects cholesterol metabolism and lowers LDL, the bad cholesterol. A magnesium deficiency directly raises LDL levels and blood glucose, which increases the risk of atherosclerosis. If you're taking statins, say rosuvastatin, but your cholesterol stubbornly won't come down even at 20 milligrams, try adding magnesium. Its presence significantly boosts the effectiveness of those drugs. This isn't theory, it's what I see in practice. Your brain, nerves, and anxiety. The natural antidepressant. Do you feel anxious for no apparent reason? Irritable out of nowhere? Can't sleep or your sleep is shallow? These are classic signs of magnesium deficiency. Magnesium regulates neurotransmitters, the chemical messengers that nerve cells use to communicate. It influences the release of adrenaline, cortisol, and noradrenaline, your stress hormones. This is why magnesium is officially classified as an anxiolytic and a nervous system relaxant. Here's another remarkable function that almost no one talks about. Magnesium regulates the release of acetylcholine from cholinergic receptors in nerve tissue, a substance directly tied to memory. This is why magnesium is especially important as we age. It literally supports memory function. And then there's sleep. Magnesium promotes the production of melatonin and serotonin. That's not marketing language, it's biochemistry. So the best time to take magnesium is in the evening, before bed. It relaxes your muscles, calms your nervous system, and helps you sink into deep restorative sleep. Blood sugar and weight, the unexpected connection. If you have insulin resistance, which is essentially pre-type 2 diabetes, a state where the body loses sensitivity to insulin, magnesium isn't just helpful for you, it's essential. Magnesium participates in breaking down glucose and lowering blood sugar. It improves cellular sensitivity to insulin. When the body doesn't get enough magnesium, insulin levels rise, weight starts climbing, and the person has no idea why because they feel like they're eating normally. Regulating blood sugar and insulin is one of magnesium's core functions, which is exactly why it's indispensable for people with diabetes. Muscles, bones, and protein. Magnesium is calcium's partner. It influences calcium ion transport and regulates the exchange of phosphorus and calcium and bone tissue. Without adequate magnesium, calcium simply doesn't absorb the way it should. For muscles, magnesium is essentially the switch for normal function. It helps muscles contract and relax. Muscle cramps, especially those nighttime calf cramps that plague pregnant women, are in most cases a direct consequence of magnesium deficiency and disrupted electrolyte balance. If you exercise, even at a recreational level, your magnesium needs are higher than someone who doesn't. It gets used up during muscle work and lost through sweat. And one more thing most people miss. Magnesium is essential for protein synthesis and DNA replication. Hair, skin, nails, hemoglobin, collagen, all of these are protein, and for that protein to be synthesized correctly, you need magnesium. Skin and aging, magnesium against time. Something important for anyone who cares about their skin. Magnesium prevents premature skin aging and hyperpigmentation, those dark spots that appear during pregnancy or just seemingly out of nowhere. Magnesium deficiency disrupts the molecular mechanisms that control melanocytes, the cells responsible for pigmentation. On top of that, it leads to breakdown of the connective tissue matrix, loss of elasticity, wrinkles, sagging. Hyperpigmentation is one of the markers of premature aging, and it's directly connected to low magnesium. Pain relief and immunity. Magnesium has analgesic properties. It slows down the excessive transmission of nerve impulses from the brain to peripheral nerves and muscles, suppressing pain signals. This is why magnesium reduces headaches and acts as a powerful natural sedative analgesic. A separate note on immunity and cancer. Many supplements cannot be taken by people with a cancer history. Magnesium is an exception. Especially when combined with vitamin B6, it can be taken even by those who have had an oncological diagnosis in the past. Moreover, magnesium is important for the function of T lymphocytes, the cells of the immune system, and may influence the effectiveness of cancer immunotherapy. Warning: how to tell if you're low on magnesium. Check yourself right now. Here are the symptoms most people never connect to magnesium deficiency. Anxiety for no obvious reason. You're not under pressure, nothing bad has happened, but there's a restlessness inside that won't go away. Eye twitching. You're sitting, working, and suddenly your upper or lower eyelid starts pulsing on its own. Classic sign. Hot flashes during menopause or severe PMS. Muscle cramps. Poor sleep, struggling to fall asleep or waking up during the night. High blood pressure or a feeling of irregular heartbeat. You drink a lot of coffee, consume alcohol regularly, or take oral contraceptives, antibiotics, or diuretics. All of these actively flush magnesium out of your body. A word on alcohol. A lot of people drink to relax when they're feeling stressed or anxious, but here's the paradox. Alcohol actively depletes magnesium, so when the effect wears off, the anxiety comes back stronger than before. Sometimes it escalates into full panic attacks. That's not a character flaw, that's biochemistry. Where to get magnesium from food? The absolute champion for magnesium content is raw pumpkin seeds, truly one of the most underrated superfoods. After that, raw nuts, sesame, and everything green, leafy greens, and fresh vegetables. The chlorophyll that gives plants their green color is a molecule built around a magnesium atom. But here's the reality. Even with an excellent diet, it's extremely hard to hit optimal magnesium levels just through food. That's why for most people, supplementing makes sense. This is where most people go wrong. They buy the cheapest magnesium supplement and after a month say magnesium doesn't work. It does. They just picked the wrong form. Magnesium sulfate, intravenous only. In tablet form, it doesn't absorb and causes severe diarrhea. Emergency medicine, not a supplement. Magnesium oxide, the most common pharmacy form. It's in most old-school magnesium B6 products. The magnesium content looks high on paper, but bioavailability is very low. Only a small fraction is actually absorbed. Not the best choice. Magnesium lactate, also low bioavailability. Not recommended. Magnesium citrate, high bioavailability, absorbs well, has a mild laxative effect. Great choice if you deal with constipation. Magnesium chelate, magnesium bound to amino acids, absorbs well, almost no GI side effects, ideal for people with sensitive digestion. Magnesium glycinate, bound to glycine, one of the best forms for sleep and calming the nervous system, gentle on the stomach. Magnesium taurate, antioxidant properties, excellent for the cardiovascular system and nervous system, supports brain function. Magnesium malate, magnesium with malic acid, boosts energy, great for fatigue and athletes. Magnesium aspartate and citrate, especially good for gallbladder issues or gallstones. Here's the simple guide. If you want deep sleep, go with glycinate or chelate. If you need energy, choose malate. For gallbladder problems, aspartate or citrate. For heart and nervous system support, taurate. For constipation, citrate. Dosages. Recommended daily doses. Healthy adults, 400 to 800 milligrams. Pregnant or breastfeeding women and people with intense physical activity, 500 to 1,000 milligrams. High stress, anxiety, heavy mental workload, 800 to 1,000 milligrams. If you take diuretics, oral contraceptives, antibiotics, cytostatics, or insulin, all of these increase magnesium excretion through urine. Your minimum dose, 400 milligrams per day. How and when to take it. Magnesium can be taken with food or on an empty stomach. If it causes stomach discomfort, take it during or after a meal. Best time? Evening, before bed. It relaxes muscles, calms the nervous system, and improves sleep quality. If you have low blood pressure, take it only before bed, not during the day. If you're on a high dose, 800 to 1,000 milligrams, split it into 2 or 3 smaller doses throughout the day to improve absorption. Important. Take magnesium at least an hour before or after a grain-based breakfast like oatmeal or porridge. Grains contain phytic acid, which binds to magnesium and blocks absorption. Beyond tablets, magnesium can also enter the body through the skin. Epsom salt baths, which are simply magnesium sulfate, are a solid complementary way to top up your levels. Summary. Magnesium isn't some trendy supplement. It's a foundational mineral without which your heart, brain, muscles, nervous system, and metabolism simply cannot function. And 80% of people are deficient in it right now. Check the symptoms. Choose the right form. Start taking it. The quality of life changes, and it changes faster than you might expect. Subscribe and hit the bell so you don't miss the next one. Thank you for watching, and here's to your good health. Goodbye.